information that's accurate and factual and reduce fears. For that, our moderator today will be Mr. Tavis Banks. Tavis is a dynamic CEO of his own company that teaches leadership. And with that, I'm going to hand it off to Tavis.
All right. Thank you, Jason. Today's topic is going to be coming out of quarantine, a town hall hosted by the African American Firefighter Museum. We're an all-volunteer, donation-driven nonprofit dedicated to collecting, conserving, and sharing the heritage of the African American firefighters through collaboration and education. We have three esteemed gentlemen who will be panelists on this town hall. I'd like to introduce them. And after I introduce them, we'll get to some topics. We'll take some time for Q&A, question and answer, and then we will wrap it up. So that'll take us about an hour or so, and I hope you enjoy this presentation. So let's introduce the panel here. First up, we have Dr. Abraham. He is, one moment. Just a moment here. We have Dr. Jerry Abraham. He is, I'm going to go ahead and let him introduce himself because he can do it better than I can, and I'll move forward with that.
Sure.
Dr. Abraham.
Dr. Abraham here, Director of Kedron Vaccines here in South Los Angeles, where we have now almost vaccinated 250,000 people in South Los Angeles. We're very proud of that work. I serve as the Secretary of the Los Angeles County Medical Association. I teach at Charles Drew University, and proud and excited to be here, answer all of your questions about vaccines, and hopefully all together we'll be able to open the state back up and get back to our regular lives. Thank you for having me.
Yes, absolutely.
All right, next up we have Dr. Brian Gaines. He serves as the Assistant Director of USC Hartford Academic Center of Excellence in Geriatric Social Work at the University of Southern California. And I'll let you introduce yourself as well, Dr. Gaines.
Thank you. Good afternoon. My name is Dr. Brian Gaines, and as he said, I'm the Assistant Director of the USC Hartford Center of Excellence in Geriatric Social Work, and also the Assistant Director of Advocates for African American Elders, which is a program that is geared toward the African American seniors in the community. The only program that we have at USC that focuses directly on advocating on behalf of our older adults and give them an opportunity to voice their opinion. And so I'm excited to be here today, because one of the things that we're working on is assisting and helping support our seniors as they get ready to transition and go back out into the community. And so just looking forward to seeing how we'll be able to all work together to make this happen. Thank you. Thank you for having me.
Yeah.
All right, and next up we have Professor Jarvis Sands, Associate Marriage and Family Therapist, Adjunct Faculty at Pacific Oaks College in Los Angeles County. And Professor Sands, please introduce yourself.
Thank you, Mr. Banks. I appreciate it. And to the esteemed colleagues on the rostrum, I really appreciate this. This is a great opportunity. I'm going to come from a mental health perspective of how being isolated for so long, all of us have been, how that could cause some type of anxiety and stress that you may not even have imagined while you were there. So if we can just get really into those things today, I would love to talk about it and see how I can help and we can connect, because getting vaccinated is very, I'm a fully vaccinated individual, but it's the mental health component that a lot of times our family and friends stray away from because of the stigma. So we want to talk about that and try to destigmatize that and make you feel better about that.
Absolutely. And so with today's theme being coming out of quarantine, I'll start off with you, Dr. Abraham. What does coming out of quarantine mean to you? Because everyone is so excited, right? We're getting back to normal. We're going out there. Is it safe to go out there and get back to normal? But what should people know about coming out of quarantine. And one question that has come up is pop-ups. People are having vaccinations all over the country, and it's not just a hospital, it's not just your clinic, it's pop-up vaccination sites everywhere. So one of the questions is it safe, and what do you want people to know about coming out of quarantine?
Sure. I'll just start briefly by telling you a little bit about what we've done here at Kedron. Our story goes back to December, Christmas Eve, December 23rd, when we picked up the phone and we demanded, where are our vaccines? We had been forgotten about. We were not at the table when they had decided where the vaccines go. And we wanted to make sure that the people living where most of the COVID infection is where the vaccine should have gone. Not rocket science, doesn't take a brain surgeon to tell you that. And yet, as you know, as the story in this country goes, we saw it in DC, we saw it in Chicago, where the infection was, this vaccine somehow landed in the exact opposite parts of town. And so we weren't going to let that mistake happen here in LA. So we demanded our vaccines. We finally got them New Year's Eve, and we got 50 doses into the arms of our nurses here. We were dying from COVID. We had COVID positive nurses and patients. It just didn't make any sense why you wouldn't send them to South LA first. And then we knew that we didn't want enough just for us and our staff. We wanted to make sure that we had enough so we could protect all of the Black and brown healthcare workforce that were shut out because they don't work at Kaiser Permanente or Dignity, USC, UCLA, Cedars, all the big places that got them right away. We knew there were a lot of small mom and pop doctors' offices or clinics and that they needed vaccines too. And then we made sure that everyone, including when they said 65 and older are eligible, that they too would have access to this shot. And that's how we went from 50 doses to now almost 250,000 doses into the arms of South Los Angeles. What we did exceptionally well was we broke down every barrier that stood in between people and their vaccines. No appointment, that's okay. No internet, no email, no cell phone. I don't have a car, no transportation. I don't see, hear, talk, walk. None of those are reasons not to get vaccinated. We have people experiencing housing insecurity, not having an address, not speaking English, not having documentation status in this country. None of those were reasons to not get vaccinated. And yet all those were barriers that stood in the way. When people ask, how did we get so good at it? How did we become the center for excellence, the exemplary role model for equitable vaccine distribution in this country? We said, COVID or no COVID, this is what we do every day. We help people overcome all of those disparities, all those social determinants that stand in the way between people and health equity. It's truly a race against time, not a moment to lose, not a drop to waste. This is what it takes to achieve that health equity that everyone in our community deserves. And so to that question there, first off, what does it mean for us? For us, getting vaccinated really means back to life, back to work, back to school, back to loving our loved ones, hugging and kissing on grandma, back to church, back to worshiping collectively. To us, that's really what this shot of life is to us. And that's why so many of us are committed here in healthcare, making sure that you get access and that we take the time to engage you, we educate, and hopefully we vaccinate you, and then you become activated, and then you help your household, your family members, your church members, co-workers all get vaccinated also. As far as the pop-ups go, it's a challenging question because ideally, you go to someone you trust. Ideally, you have a clinic, a healthcare team, people that are your trusted health navigators that, where you go. But what the reality is, we know that's not a luxury everyone has. That's why us going back to business as usual is not going to work, because not everyone was a part of the healthcare system to begin with. So to just say, go to your clinic, go to your doctor. Well, what doctor? What clinic? I haven't been to the doctor in ages. As you know, even amongst Black men, going to the doctor, the rate low. People are not getting their blood pressure or diabetes treated. So say, just go to your clinic or hospital. That doesn't work. That's why today, for example, we went to Nickerson Gardens, and that's where we vaccinated all. We're still vaccinating right now because you got to meet people where they are, where they live, where they work, where they go to school, where they worship, where they play at the parks, recs. We did a Divine Nine event recently with the fraternities and sororities. I mean, so you really got to find ways to get to people. And the concern, of course, with the pop-ups are, well, will they be there when I need my second dose? What happens if I have a question? So that's why trusted healthcare like Kedron being there, giving you your vaccine, even if it's in a park or in a housing community, you get our card, you get our number, you know where to find us. We're here every day like we are right now. So even though you may have gotten it somewhere, you always come back to the clinic and know. And so this truly is, in many ways, the gateway drug to primary care, to mental health, to preventive services. So hopefully, you know, whenever you are offered a shot, wherever it is, ideally in a location where you feel comfortable and you've had all your questions answered, you should take that shot, even if it's at a pop-up.
All right. Thank you, Dr. Abraham. That's some amazing work that you are doing right now. And I hope that continues for a long time. Dr. Gaines, moving on, you work with a lot of seniors, and I'd really like to know, what does coming out of quarantine mean for you? And then what does coming out of quarantine mean for our senior population?
Yes, yeah, thank you for that question. Well, for working with the seniors, it's really it's a time for us to really reflect that there's a lot of healing that has to take place, you know, before we, you know, start re-entering into the community. There's been a lot of loss. You know, there's a lot of depression and mental health. You know, when we talk to seniors on the phone, many of them are lonely, and this was pre-COVID. You know, this was happening before this happened. And so, you know, and so reconnecting them, you know, the first thing is that, you know, making sure that they're healthy to return back to the community. You know, many of them have been, you know, sedentary now, you know, sitting for a while. So you know, so they're afraid of falling. And so, you know, all it takes is one fall to break a hip and, you know, end up in a nursing home. And so, you know, trying to, you know, look at ways to coordinate that effort to make sure we're checking in with the seniors to make sure that their balance is intact, you know, those kinds of things, you know, looking at all of those things. And, you know, I'm kind of glad, you know, that the infrastructure is one of the things that's being talked about, because, you know, being out in the community, we worry about them falling, you know, on the, you know, the pavement where you have the trees and the sidewalks, you know, in some of the communities we work in. And so, so really working really closely with them to identify that all of them are not in the same place. You know, there's varying different levels. There's different levels of comfort, you know, just as it was with the, you know, getting the vaccine. You know, we're still, you know, there's still some out there that are still hesitant. They're still waiting, and they still want to talk, and they still want to have conversations. And, you know, the only thing we can do is to continue to give them the information, make sure that they have it, make sure that, you know, when they have questions, that we give them a space and a place to ask those questions, you know, whether it be a teletown hall, whether it be, you know, via Zoom, or, you know, whatever their level of comfort is with technology, you know. I mean, the same thing with reaching out for services. You know, many of them are going to need mental health services, you know, but a lot of them don't even identify. They don't even understand, you know, what that really means, you know, what they're actually feeling. And so, you know, having a better understanding, you know, around education, you know, educating people about what's going on and what they have access to, you know, and just working around this whole ideal of equity. You know, we have a lot of things that, you know, kind of, you know, prohibit us, you know, as social workers and working in the community from being able to, you know, get, you know, our seniors the things that they need, but, you know, whether it be transportation, you know, there's always these barriers, as Dr. Abraham talked about, which we had to work through with COVID, you know, making sure that, you know what, it's okay. So there's a phone number to call to get a vaccination. It's like, you know, sometimes they need help with that process, you know, helping walking them through that and understanding what they need to do, you know, and going online, making appointments, calling in and checking with them, you know, even from the very beginning, our work, you know, we started off with the first thing is like, okay, let's reach out to all of the gatekeepers is what we call them, you know, so all of our directors of the centers and check in with them and see, okay, so how's the things going in the senior housing? What's, you know, what's happening? Give us a sense of what's going on, you know, and then the next stop was, you know, we got on the phone and we start calling all the seniors around the community, you know, just be really just checking in on the basic needs, you know, do you have, at that time, it was like, do you have enough food for the next couple of weeks? You know, do you have the products that you need? And, you know, that was one of of the things we were able to work with WLCAC to get some hygiene kits out to people, you know, some gloves and some, you know, sanitizer and toilet paper, those things, you know, and we thought, you know, we had to be creative, you know, figure out ways. It's like, well, they're already delivering home meals. Let's just give them these kits to take with them while they deliver the meal. You know, that way that'll cut down on extra contact. And so, you know, we were able to, you know, just do things like that. And I think, you know, another thing for us is coming out of quarantine means that we have a whole new cohort of seniors that we're working with that were kind of lost in the community, you know, but through internet and through teletown hall, we've connected with folks that, you know, what we call hard to reach, you know, because they needed, you know, they needed food, they needed access to things. So they had to reach out for services. And so in that sense, you know, it's an opportunity for us to really look at how we've been able to connect with this whole new group of seniors that are in need of services, and some of them have connected with, you know, different programs, you know, around, you know, healthy lifestyle changes and things like that. So there's been some things, but at the same time, we have those that have really fallen off. You know, when we check in with them, you know, they've gained a lot of weight, you know, they've been eating a lot of snacks, and so, you know, the chronic health conditions have only worsened. You know, and the fact that they haven't had dental visits, they haven't had eye visits, they haven't had doctor visits. And so, you know, just trying to get everybody on board and trying to assist them with being able to like get those basic things out the way so that when you do step back into that senior center, you know, that you're in good condition. You know, you've gotten your podiatry appointments out the way, you feel healthy and you feel good. And so that's kind of, you know, that's where we are in looking at ways that we can work with other organizations and come up with creative, you know, ideas and opportunities, you know, to continue to work with, you know, with those, you know, particularly the ones in the underserved, you know, areas that really, you know, are just get lost in the whole equation, you know, even from, you know, the increase in homelessness, you know, that we're starting to see, you know, that's going to be part of this whole, you know, coming out of quarantine, we're coming out of this with a whole lot of more seniors being on the street, you know, that some of it has to do with COVID, but some of it has to do with, you know, things that are happening with housing, you know, rent increases and things like that. And so, you know, some of those propositions that are, you know, leaving our seniors on the streets. And so, you know, we have a lot of work to do. And so, you know, this is a great opportunity for us to start this conversation and begin to look at ways that we can all, you know, collectively and collaboratively work together to make these things happen, you know, in these communities and for our seniors. You know, at the end of the day, for me, the work that I do, it's my career, but it's a ministry at the end of the day for me in terms of working with those that have paved the way for me. I was born and raised in Los Angeles. And so, you know, I know all about the restrictive covenants and all the things that have happened and how they fought so hard for us. And so, you know, our reasonable duty is to make sure that, you know, we make sure that they have equal access to all the things that they need.
All right, that was powerful, hard hitting, Dr. Gaines. There was a couple of things that I took notes here on. One is working together. I think I love that because we used to do that back in the day and not so much anymore, right? But I'm seeing a resurgence of people of color actually working together. So I love that. And then you just stressed information, sharing that information, because people can only operate at the level of information that they have. So if you don't know, you don't know. And sometimes it's, you know, just that you don't know what you don't know. So we have to share the information, work together to actually fight this thing and come out of quarantine successfully. So thank you, Dr. Gaines. Professor Sams.
Yes.
We're moving on to you. I mean, this one, your section is, and we all can speak to this as well, but I'm glad you're speaking on the mental aspect of it, because a lot of us, you know, we just move through from day to day. We just keep on soldiering through, right?
Mm-hmm.
But the mental aspect, it takes a toll. And I'm really excited about hearing how has your experience been with dealing with folks during quarantine and now coming out of quarantine? How's their mental health?
Wow, that's a really good question. So I want to start in a different space really quickly. Prior to quarantine, business was okay. We'll just say that, you know, we had a handful of people who would come in. Black folks were fearful. You know, whenever you talk about mental health, we have a stigma associated with it. But somewhere around the middle of quarantine, I want to say about June or July, we figured it out. It's like we can't be in these rooms by ourselves. We can't be stuck without talking to someone. And it got overwhelming for me as a therapist because it's now 30 or 40 people that are asking. Okay, 30 or 40 people who are asking, can you hear me? Okay, all right. And um, and then that was just, and then there were other people that I had actually in a waiting list. And I'm passing them on to other colleagues. It got really hectic. And even in the last couple of weeks, it's even gotten greater. Um, so one of the things that Dr. Gaines was speaking about indirectly is wraparound services. We miss that oftentimes in our community. We used to have it in the 70s and the 80s. I'm from Miami originally, living in Los Angeles now. The wraparound services were in place, right? Now, like in the 90s and the early 2000s, they disappeared in our community. And this is important for us to work as team. Is a team environment. So part of my work would be wanting to work with Dr. Gaines and Dr. Abraham and others in our community to say, you someone who is having issue, coordinate with me or coordinate with another person in mental health to say, to come in and talk about the cognitive distortions they may be having, not necessarily just around the vaccine, but just in their life. You know, how are they dealing? Are they going to be able to maintain? Are they going to be able to refocus coming out? So there's a lot of distortive thoughts that are going on, and that becomes a problem because it's a hindrance not only to getting vaccinated, but it's also is going to be a hindrance when you come out of COVID, because now you're going to maintain those cognitive distortions. So we want to deal with that. So that was where I would start. I want to use this as an opportunity, as a platform, to talk about someone just wrote a wraparound services. So wraparound services are where a community of health individuals work together. So you may have a social worker or a case manager, you may have a mental health therapist, you may have a primary care physician who all work together to ensure that your health is together, all together. You have a place to live, you have food on the table, and what you see a lot of times is in our community, the church has actually stepped up and done a lot of that. They actually provide a lot of those wraparound services because they will do food banks and so forth and so on, right? But with COVID, the churches were overwhelmed, right? With COVID, the community centers were overwhelmed. So now it needed to be more about having private individuals who are working in the field, whether they work at a community center or what have you, that come together and figure out how are we going to connect to ensure that our clients and our patients get the need that they have. So I hope that answered your question. I'm sorry, I didn't see who it was from, but I hope that helped answer your question. So ultimately, for me, what I want to do is psychoeducate individuals in my community on what mental health services look like. It's not that you are having a mental health breakdown, because that is part of mental health, but sometimes it's just about maintaining the quality of life that you've had over the course of your life. So as you get older, you know, sometimes your cognition slow down. You're not able to react as quickly as possible. And coming in and speaking to someone, especially geriatrics or seniors, coming in and speaking to a mental health provider, what they do is help you figure out where you are. Something as simple as a mini mental health exam, which is about a 4-question questionnaire that most health providers will ask you. You don't even realize that you're being asked something about your mental health, but it happens quite often. So those things where you would come in and sit down with someone like myself, realize that, okay, maybe some things have slowed down, or some things need to be actually reinstituted in your life. But that's what mental health services are. They're not just because you have some level of depression or you are a schizophrenic. No, those are major, right? We're talking about the minor things that you have to deal with every day, and that's what seeing a mental health therapist is about: the minor things as well as the major. But if you don't deal with the minor, they can become larger problems. Just think of it as a physical therapist. You go back to a physical therapist to get back on your feet, or you go to a mental health therapist to get back on your feet mentally. So.
All right. Thank you, Dr. Sams or Professor Sams. That was really engaging there. So I'm going to ask a few questions here, and you can be open to any of the panelists or all of them. But most of these questions that I have are related on, how can I move around? We're coming out of quarantine. The CDC is saying one thing. My friends are telling me something else. My doctor, he's saying something that's different. So questions like, is it safe to ride around a car with an unvaccinated person? Or is it safe to stay in a hotel? What would you say about that, Dr. Abraham?
Yeah, and as you know, I'm literally right here at Kedron, and we are vaccinating some individuals, and I'm going to help vaccinate right now. But you're absolutely right. You're getting a lot of mixed messages. Just wanted to go back to a couple things that Dr. Gaines mentioned, and therapist Sam's here. This is not only a shot of life that prevents us from getting COVID infection. This really is the shot that alleviates that mental health burden. We've seen that increased depression, anxiety, panic disorder, all from this isolation, social illness that COVID has brought upon us in the last 15 months. And so when you go get vaccinated, I see people walk out of here with their head held high, chest puffed out, very proud, because this is what it takes to get back on the bus and not be so afraid, maybe go back to church or to go back to work, to go to the grocery store, not really having to fear catching COVID. But you're right, we a lot of mixed messages. CDC and Biden and Newsom, they're all saying, oh, ripping off their masks and they're just going to go do their own thing. Here in California, the California Department of Public Health, and here in Los Angeles, we still have, mask orders in place. And that's because there's still plenty of people that still need vaccines, as you know, and we're not done with infections. There's still infections, even though they are declining here. There are plenty of people who can't get vaccines, even if they would want one. For example, people under 12 years old. So you can still pass it off to younger children. There are people that have had COVID and had special treatments like monoclonal antibodies. You may have heard words like Regeneron, those kind of things. Those folks are still going to be susceptible to if they come in contact with COVID. So we want to still be very mindful. We don't get vaccinated just for ourselves. We get vaccinated because we also love others. It's kind of, that example that as Christians, as people of faith, we think about do it out of service, not only to ourselves, but to our whole community. That's the obligation. That's the burden of love. So I know it's frustrating to wear masks. We still need to socially distance. We still need to wash our hands. We still need to get a vaccine when it is available to you, when you can get it, hopefully after we've answered all your questions. But yeah, you're going to get some mixed messages. Ideally, in the presence of vaccinated people, you can start taking off your masks if you're in a controlled situation, let's say your home with a group of 2 or 3 people and you're all vaccinated. This is really the privilege of being vaccinated, that we can start unmasking. But when we're in large crowds, when we're out in public, when we're not sure about the vaccination status of others, you may need to continue. And the recommendation currently is to wear a mask. We will watch the recommendations coming from our state, from the California Department of Public Health, and from Cal OSHA, the Occupational Safety and Health Administration. In the next week, on May 20th, they will be meeting again. Now, in light of the information from the CDC and others, they will reevaluate. What does it mean to be safe at work? How do we get to the state being open June 15th? Biden wants 70% of adults vaccinated by July 4th. So all these things are going to play into the decision. So what we say today will evolve, will change. There will come a day when we're going to be unmasking even more. Just know, though, out of an obligation to one another, our responsibility to ourselves, to our brothers and sisters, we do still ask that you be responsible and help one another out, because there are still people that are vulnerable and susceptible to COVID.
All right, thank you. I have a follow-up question to that, Dr. Abraham. And the question is, they say, we always hear about they, right? We never know who they really are, but they say the vaccine is good for at least 6 months. how do we know if the vaccine is wearing off?
Great question. Part of us as healthcare messengers, not only is the message important, but who brings you the message, trusted sources, as we talk about, real deep out there, misinformation out there. Where do you get that information? There are people that are definitely trying to attack our community and make them question this vaccine. Is it for me or not? And yet we know historically what our communities have gone through are real, whether it is the Tuskegee trials, whether it is the abuse of Henrietta Lacks cells, whether it is the undertreatment of pain in the hospital, medicalization of racism in this country. So there are a lot of reasons to definitely be skeptical and wonder who can I trust, but then also be very careful about getting your information from places, whether it's on social media, Facebook, etc. But in terms of how long does immunity last? We have to be honest with you too. This is a new virus. We're still learning a lot. These vaccines were developed in the summer of 2020, Pfizer and Moderna, and then Johnson & Johnson in the fall of 2020. What we know is that so far, all the studies, the people that were in those clinical trials are still being followed, and the immunity is still strong. If you get COVID, right now, evidence suggests 3 months to 6 months or so protection, but you're better off getting the vaccine and never getting COVID, and that protection lasts longer is our current indication. The people that got the COVID vaccine in the clinical trials in the summertime still have good immunity. Unlike the flu virus, the COVID virus doesn't evolve as fast, doesn't change, doesn't mutate, doesn't have variant strains as much as the flu shot. So we can't tell you with a straight face right now whether we're going to recommend this every year. There are people who are more vulnerable than others, as we're mentioning, as Dr. Gaines mentioned, seniors who may have underlying medical conditions, who are at higher risk for a lot of reasons. They may need a booster shot. That may be coming. You may have heard Pfizer and Moderna say that publicly. So a third shot booster may be coming, particularly for people over 65 and those with underlying medical conditions. As far as how long people that the 2 shots, Moderna, Pfizer, or the 1 shot, Johnson & Johnson, when will they need to get another shot? Can't tell you for sure yet. But as you see with a lot of vaccines, whether it's tetanus, diphtheria, DTaP, Tdap, these are all vaccines that we give on a regular basis. You come back in 3 years for a booster. Some people come back in 10 years for a certain booster. We check your levels of antibodies floating around in your blood. That's a blood test. We take some of your blood and we look for those antibodies. We call them titers. When we see the levels are good, then we don't give you another booster. But when they're low, let's say you're a healthcare worker, a nurse's aide, a nurse, a doctor, we check your blood levels and we see that they're low. We might offer you a booster before you go and work in the hospital again and expose yourself or expose others. Those are the types of strategies. We may see the use of blood tests to help us better decide who needs boosters and also whether you have sufficient immunity. But currently, all indications are that all 3 vaccines, Moderna, Pfizer, and Johnson & Johnson, are protective against all of the variants and strains of COVID-19 out there. They are exceptionally well, in fact, 100% effective at preventing death due to COVID. So that is number 1. We wanted to survive this pandemic just as much as people from other zip codes, wealthier people, etc. And that is what these vaccines provide us. They also make us go to the ICU less. They make us admitted to the hospital less. People talk about the flu shot. I get my patients, grandma comes in and goes, "Doc, you gave me the flu shot and I still got the flu." Yeah, but then I say, "Did you get pneumonia? Did you end up in the hospital? Are you alive?" And so she's like, "Okay, you're right. It wasn't so bad." So that may you see and hear, they're going to be people that got the vaccine, still get COVID down the line, but they're not going to get admitted. They're going to have very mild illness. You saw some Yankee players, for example, in the news that got COVID, though they were doubly vaccinated. Most of them were asymptomatic entirely. So just know these vaccines really work. Most importantly, prevent death, and they prevent you from going to the hospital and needing a ventilator to stay alive. Thank you.
All right. Thank you, Dr. Abraham. Dr. Gaines, we have a question from seniors here that says, are there any general rules for living in a senior complex? Miss Johnson, I don't know if she got vaccinated or not, but I live right next door and I play bridge with her or what have you. Should I be worried about that? Are there general rules for those complexes, and what can you tell us about that?
Yeah, well, I can tell you definitely when we think about senior housing complexes, one thing for sure is that all are not created equal. So it really just depends on the leadership, within the complex that the senior is living in, which is critical, because those leaders that are in those senior housing complexes, they are following the guidelines, they are listening to the experts, they are following science, and so they're making sure that their residents, are getting information, even if it means posting it on their door, not so, if it means making copies in their office to go around and make sure that they know about, where things are, what's going on. Whereas you have in some senior housing, you don't have that level of leadership to where they're not getting that information. A lot of them are relying upon, just, basic, information that's out there. And so, but as Dr. Abraham was saying, it's those trusted sources that are bringing that information forward. And I think as we work with seniors and seniors are asking how they can talk with their friends and things like that, I really think it's a lot of what Dr. Abraham was just saying is really about how we carry the message. It's really talking about the benefits, because seniors love benefits. They love when you talk about, what's the benefit in it for them? What am I going to get out of it? And so I think that's really, he hit on something that was really important is talking about those benefits, of seeing those grandbabies and being able to interact and go out and, and not be able to, end up in the hospital because you're going to get sick, from getting COVID. So all those things. And so I think, that's, again, education is changing the narrative around how we're talking about it. And I think, also the same thing, with mental health, that's been stigma for years, and just sometimes, just mentioning the word mental health can, cause a person to, not want to have that conversation. And so, as we talk about, it being health and wellness and well-being and all these other, words that, as we have these conversations, I just think, more education around it now more than ever, because, we have so many people now that are dealing with what we call mental health issues in the profession, but at when I'm working with the seniors, we get down into really the benefit of understanding, your well-being. And so, and making that link between getting the vaccine and knowing that it can help you with your well-being, physically and mentally, because that's one of the concerns. That's one of the concerns when we polled some of the seniors out there. That was one of their concerns. They were concerned about, not only just their mental health, but, and we kind of tied this in with mental health, but they're concerned about their cognitive decline. Because of no interactions, there's this cognitive decline. And so forgetfulness and things like that, memory loss, things that are taking place, which is very scary. It's scary for, for seniors, especially if you're living in senior housing and you're on your own, you don't have a lot of support, excuse me, and you find yourself in that situation, it can be, it can be quite an eye opener for you, as you're looking at all these other things that you're dealing with. And so, yeah, I just think that, that it's an opportunity for us to kind of really continue to educate, and get more information out there, through our trusted sources, in the senior housing complexes in terms of what they can do. And, and just rule of thumb, just continue to follow, the science, and whatever, because people have varying levels of comfort. And so, following the rules that have been set forth in the senior housing, I think is important, and letting people, have their own views and their own understanding and just trying to be a little bit more compassionate and understanding about where people are, because everybody hasn't had the same experiences. And so, and when we talk about seniors, they've lived through a lot, there's a lot of things they've lived through. And so, we got to be a little patient as we begin to roll things out and be open to ideas that they may have. They may have ideas. It's like, that's what we pride ourselves on, is that we go directly to them to find out exactly how things, what's missing, what do we need to do to make this better for you. And so I think we really, we have to just give them an opportunity to just, open up and share their concerns, and we figure out, ways that we can be creative to help, facilitate, this whole process of them being more comfortable at being around and out, and, and take it one day at a time.
All right, awesome. So Professor Sams, just kind of piggybacking on what Dr. Gaines said, how can our seniors and others feel comfortable? How can they mentally prepare themselves to actually going back outside. And some of them have been turned into kind of hermits, right? So just stuck inside, not going anywhere. How can we encourage them, and how can we mentally prepare them for going back out?
So that's another great question. So one of the things that we can do is community-based organizations or churches can actually start to incorporate them more. So I had firsthand experience with this. My mother, who's a senior, she's 77. I'm glad she's downstairs so she can't hear me say that. But she actually had a major car accident in the middle of COVID. And spent literally between 8 to 9 months between hospitals and nursing homes and independent living, and recently got home. And one of the things that we had to do is, as the doctors will probably explain, in the beginning, they weren't letting people in any hospital. You can see them, you can do anything. So a lot of it was trying to get my mother up to speed with technology. A lot of our seniors are not up to speed with technology. And mental health services right now being provided via telehealth. So we're doing Zooms. Brother Johnson said, asked me to log on. I was like, I do Zooms all day, every day. This is what I do. 9 to 10 hours a day I'm on Zoom. But my mom can out, and I'm sure a lot of other seniors can. When I have a few senior clients right now, they have the darndest time. So I have to be more patient. As a therapist, I'm like, give them a 10 to 20 minute window to get in and get the video up. It takes a little bit of time, but then working with them about things with their cognitive decline. Okay, have you noticed this? Have you noticed that? Talking to them. One of the things that my mother loves is the word search puzzles, right? Those are very good to keep the person going. Playing cards is a good one. That was great. And Judy, I saw that you said that you fully vaccinated, so they can come play cards with you. So yes, playing cards with whoever needs to be played cards with, those type of interactions, because that's been going. So it's a slow process with everything. It's like, yes, getting vaccinated, but then it's also like taking baby steps and slowly but surely getting them back reacclimated to interacting with folks, and maybe through technology, because technology's come a long way. Most of us have a cell phone that will actually allow you to do video calls right on it, but most of us may not know how to use that video chat feature. So working with them to ensure that can help them if they have a manager or they have a younger family member who could show them how to use that, that would be great. So I would say take the time, ensure that you're spending time with them. Some of it's not necessarily they don't need to see a mental health therapist, right? What they may need is just family members to be checking in with them and making sure that if they do see some decline, that they do speak to either a mental health provider or a primary care physician to ensure that they can recognize that there are some things going on. There may need to be medication, there may not need to be medication, but that conversation would be something that would be a collaborative effort between the family, the primary care physician, and their mental health provider.
All right. So I have a question in the chat here. It's a medical question. The CDC says side effects are a sign that the vaccine is working and your immune system is kicking in. If you get your second shot and don't have any side effects, does that mean it did not take?
Great question. Yeah, that is actually called reactogenicity. That is when your body is mounting a response. That's what always happens with vaccines in general. Your body, you get the little message. That's what it is. It's like a little vehicle, and inside the vehicle is the engine, and that engine's just this information. So that's what Moderna and Johnson & Johnson is bringing information in that is telling your body to build a response. And unfortunately, sometimes people have a lot of response. They might feel a little feverish, muscle aches, a little under the weather. That's what after the flu, people go, oh man, that was worse than getting the flu. And I'm like, okay, now you're just exaggerating. But, that happens sometimes. And the younger, the healthier you are, you might have more of a response. That's okay to dampen it down. You just need 95, 100% effectiveness. Nobody's trying to ramp up to 150, 200%, response. So take that ibuprofen, take that Tylenol. That is okay. It is totally appropriate to not have to suffer through it. That's not what we're trying to do. We ain't trying to make you suffer with this vaccine. We're trying to help you live and live your life honestly. And so that is a normal thing called reactogenicity. After this vaccine, now there are people who test positive and they're like, doc, I just got vaccinated. So there are people that have been exposed right before or got COVID right around the time they got vaccinated, but the vaccination itself does not make you test positive for COVID. So just keep that in mind. I know some people are sometimes curious about, will I test positive? Not from the vaccine. So if you do test positive, you were around COVID, you got COVID, and that's going on. Can you get COVID even though you've been vaccinated? Unfortunately, the truth is, as these variants go out there are some cases of people, very rare, that actually get COVID even though being vaccinated. But we'll just continue to watch those things carefully. Vaccines work. We wouldn't recommend them. I myself, Dr. Abraham, would not recommend them. Ken, a trusted care partner, this historically Black institution started in 1955. 22 Black psychiatrists wouldn't offer these life-saving medicines if they did not work. And so, definitely get them, but apologies if you feel a little under the weather after you come, do take some Tylenol or some ibuprofen, and we'll get through this. Thank you.
All right. I have a follow-up question to that, open to anybody really, but I have a tight family circle. This is a question from the chat. I have a tight family circle of about 8 people. Only a few of us have been vaccinated, and some have said, I'm not getting vaccinated. So this is a tough one because it's family, right? What should we do about family gatherings? What's your advice there?
I'll just say that from the CDC perspective and from our California Department of Public Health, if there are unvaccinated people that are a part of this family affair where they don't all live in the same household, then, responsibly, we should just try to continue to wear masks, be as responsible and socially distanced, wash our hands. And that's probably one of the best ways to approach that situation. And, we don't want to create any family feuds or food fights. So definitely helping people understand maybe why they do or do not want to get vaccinated, respecting people. I always say your body, your choice, your rights, your vaccine. And so leave it at that. We do the best we can. We try to give you all the information that we have as honestly, as straightforwardly as we possibly can. And then, we always just your GPS, we're just your navigator. Then now it is up to you to do with it what you will. But often people just haven't been given the information, weren't given a safe space, weren't really allowed to be vulnerable and to think about it and then choose. So that's really what we try to do. But even then, you're going to find people that say, not for me, not today. And that's okay. And we just got to respect people where they're at, and hopefully they'll come around, or there may be good reasons why they don't want one. And that's the reality. But as many of us that can get it, that's how we end this pandemic.
All right. Another question I have, summer is coming up, and that's a lot of travel, a lot of events, a lot of parties. We saw what happened with spring break. If you watch the news, I don't know, I was kind of a little scared about that one because there were so many people, I think even more people going out just because they hadn't been out before in so long. So what do we do about summer? Can we go on that cruise? Can we go, to the casinos? Can we go to Vegas? What are your thoughts? And this is for any of the panelists. What are your thoughts on that? Because there's several different aspects here with traveling.
Well, I'm currently traveling because of my mom being sick. So I've been traveling pretty much every month for the last year. And it's gotten, I would say, LAX was packed on Thursday night. It was ridiculous. I'm still exercising a high level of caution, even though I'm fully vaccinated. I'm masked up from the time I get out of the car, walking through the airport, until the time I get into my rental car or even get home to my mother. My mother's fully vaccinated as well. I feel like if you can with certainty know that your family members and friends that you're going to be visiting are fully vaccinated, then, I mean, there's some level of safety there, that no one's going to get sick, as Dr. Abraham said earlier. And, you know, you may get sick, but you're not going to pass away. It's not going to be deadly. So in that respect, if you can actually coordinate it, I think you would be fine. But it's definitely a decision that you have to make individually, of how you want to handle that. But I know younger folk, you know, they are definitely trying to get back out there into the world, and they're very impatient, because they had a whole year taken away from them, and so they want to get back to that world. And I know some seniors as well, are trying to get back to what they were doing previously, traveling and so forth. I think if you can exercise an abundance of caution, then you should be fine.
Any thoughts, Diane?
Yes, I'll jump in there. You know, one of the things for me in talking with the seniors is about doing these types of things is really, you know, having conversations about alternatives, you know, things that, you know, that you may do different, you know, for right now, you know, just because there's so many uncertainties and so many things. So really trying to, you know, have conversations, you know, about what could we do different, you know, what could we do that's closer. You know, the other thing too is it just depends on which group of, you know, seniors we would talk about. Healthy seniors, you know, versus those that have these underlying conditions in terms of your engagement. And so that's one of the things that I'm always cautioned when we talk about how fully engaged they should be, you know, just kind of, you know, especially right now, because we still don't know a lot, you know, and because everybody's vaccinated, fully vaccinated, you know, I say continue to, you know, practice all the precautionary measures, you know, particularly because you have these underlying health conditions. And so if you can avoid being a part of, you know, these big events and big things, I mean, you know, unless it's something that, you know, that's critical, that you really need to be a part of, you know, we're kind of, you know, we're not trying to make them be alarmed. We're just trying to make them, you know, just use common sense in terms of how you approach these things and things that you know, and we want them to be engaged. We want them to get out there and do things, but at the same time, you know, we want to make sure that they're healthy as they return, you know, back into the community, you know, just because there's some uncertainties. And so, you know, we say, you know, we just, you know, our advice to them is basically, you know, just continue with all of the safety measures that you put in place that's been working for you. It's kind of, you know, yeah, we're vaccinated, but if you have to get out there, you know, then actually, you know, make sure that you're doing that, you know, and then, like I said, you know, really also, you know, just really opening up and having more conversations about other things that we can do so we can get them re-engaged, you know, without jumping on a plane, without getting on a cruise. You know, that's something that, you know, we can talk about that down the line. But right now, let's talk about other ways, you know, other opportunities that may be there. You know, and that seems to be, you know, working well as we begin to have these conversations, because a lot of them will say, well, I hadn't thought about that. You know, maybe I don't necessarily have to do that. You know, you kind of pick and choose and, you know, kind of think about your own condition, you know, and how healthy you are and what you should be doing. And so I think just more of that, you know, and educating people, you know, about what's available, you know, but at the same time, you know, we're talking about a lot of downstream, you know, work, you know, right here. But there's going to have to be more upstream work, you know, because even pre-COVID, we had issues in terms of policies that created barriers, you know, for a lot of seniors to have access. You know, we talk about technology and things like that. It's not necessarily that they don't know how to use it or can't be trained. Some of them don't have access to it, don't have access to internet services, can't afford it, you know. And so all of these, you know, continue to collaborate with organizations that are, you know, trying to bring, you know, broadband to everyone. You know, these are all important things that we have to continue. While we're working downstream, we also got to, you know, make sure we lend our voice to the upstream, you know, in terms of letting them know what's really happening with boots on the ground. You know, we're out here, boots on the ground, and this is what we're hearing and this is what we're seeing. And, you know, and making sure, you know, there's a lot of talk around, you know, equity. There's a lot of talk about, you know, there's a lot of statements that have been put out by a lot of people, you know, but my thing is that how do we advocate to change practice? because it's one thing to say something, but if you continue with the same practice, we're going to continue to see the same problems that we have. We're going to continue to see these chronic health conditions off the chart, and there's no reason why they should be. Diabetes and all these things, they should not be in control. So, one thing we have learned is that we've just learned, we already knew we were unhealthy as a community, but when this COVID hit, it was like, it was just like all the blinders off. You can really critically see how unhealthy the community is in terms of their chronic health conditions. And this is, this is after millions of dollars that's been pumped into all these diabetes programs, and yet we still have high amputations. And so there's a disconnect there that we need to really, work on. Social workers, the doctors, the therapists, everybody needs to start looking at, there's a lot of money being pumped into this, but how do we really make these critical changes, upstream, downstream, meeting in the middle, and making sure that we, get this back down to the community level to where it's really going to have an impact. Because right now, it's just I've listened to a whole lot of talk for the whole year. And I'm not seeing a whole lot translate into how things are going to be different, because now it's like, okay, we were exposed, but if everything opens up, now we can just go back in our little silos and do everything. And that's what we have to stop now, and we have to continue this fight moving forward as we work together.
Yeah, so just to clarify there, should we all continue to wear masks even after we get vaccinated?
Can I add a couple things to that? So I really appreciate what Dr. Gaines added and what Mr. Sams mentioned. First and foremost, if you're not vaccinated, I really wouldn't recommend things like a cruise right now. I think that's really something you want to be mindful of, is like, are you safe? And then once you are safe, are you others that are also vaccinated? And if you can't answer that one, then that also should be more information that you have now to make your decision. And if you're going to be around a bunch of unvaccinated people, just know the kind of situation we can be getting ourselves into, and we don't want to create the catastrophes, disasters that we've seen in the last year. So just be extra careful. If you're not vaccinated, I still really recommend you limit your interactions with others until you can be vaccinated, because, to the very conditions Dr. Gaines mentioned, when we have diabetes, hypertension, people living with those conditions are at higher risk of dying from a lot of conditions, including COVID-19. So we just want to be careful. Another thing that I would say as far as masks go, the common cold, the flu, all of those things went down because of wearing masks. So I'm not saying you have to wear masks always, but just see how we changed our behavior a little bit, and how that impacted so many things like other infections as well. And for us to be smart and responsible in general, it's probably a really good idea, because cold season's going to come around again in the fall and winter. And so we know that these things like washing our hands, which we should have been doing, but clearly people weren't, and now wearing these masks and just being mindful of the space you're in and how close you are to one another, and whether you're in a ventilated space or not, those things directly impact whether you got the flu or the cold and COVID-19. So being smart about those things. As far as wearing a mask, those recommendations are going to keep evolving, so stay tuned. I just really sincerely ask that you do what you feel comfortable, but also be responsible, be accountable to one another. And so when we do those things, I know that we'll all make the right choice, including keeping ourselves protected and all of our loved ones around us.
All right, so I have a question. One of the questions sent in, people during quarantine were, indoors together. And as a result, we had some quarantine babies, right? So some of our seniors want to know, I want to kiss my quarantine baby and hug my quarantine baby and snuggle. Is it safe to do so?
Yeah, that's a very good question. In general, if grandparents are vaccinated, the recommendation is that they can see their grandchildren now. They can touch them, hug them, kiss them. Of course, the babies themselves are not vaccinated. Now, if mama was vaccinated and she was pregnant, or she's breastfeeding, then baby may get some antibodies from mama. So those are some good things that we know. But in general, with babies, we want to be careful and just keep them safe and clean environments, wash our hands, because babies, can have a tough time when they get sick. But if grandma and grandpa are vaccinated, then absolutely you should be able to see your grandchildren. Think about things like, am I feeling okay today? Do I have a fever? Is anybody sniffling? Those kind of things. And if so, then err on the side of caution that maybe it's not the right thing to be exposing someone to something. And those are just good practices in general, COVID or no COVID.
All right. And so we're getting to the top of the hour here. And I just wanted to ask everyone to give me some closing thoughts here. So Professor Sams, we'll start with you.
Oh, thank you again. I I'm grateful for these opportunities. I think these are very important in our community that we have this chance to debunk any myths or weird thoughts that we may be having regarding the topic and the subject. Ultimately, take the time out to actually become involved in your, with all of the services that are out there. Learn as much. The science is there. The information is there as far as regular health is concerned, as far as the vaccinations and what you should do. Yes, be mindful that there are going to be some people that want to lead you astray, but stay in the proper lane. Most of the information out there is going to guide you in the right direction. As far as the mental health component, do not be fearful of going in to see a mental health therapist, thinking that that's going to make you immediately headed to, the Arkham Asylum. You're not going into an asylum. You're not going to have any problems. No one's going to diagnose you, or what have you. It's actually just a check-in. You're just trying to make sure you're okay, that things are going well. And if they aren't going well, you're in a place to get the assistance that you need to get better. That's really what it is. There are a lot of African American Black therapists. Carolyn, I'm located in Los Angeles in the state of California. Because we're doing telehealth right now, all mental health therapists in the state of California can work with anyone from San Diego all the way up to Northern California if you just live in the state of California. So you can reach out and find those services. There are multiple places where you can find mental health services. Psychology Today is one place if you go online. If you also go to Open Path Collective, which is another place where there's sliding scale fee therapists there. There are so many of us out there. There's a large community of African American therapists that you probably didn't even know were there. I've had the pleasure of teaching about 40 of them at Pacific Oaks College. And those young men and young women are right in your community and you didn't even know it. So yes, and Judy Johnson is saying you can go to the Carradine Center. So there are many places where you can go to get the services, those that you need. And please don't fear reaching out. We're here to help.
Dr. Gaines.
Yes, thank you. Well, yeah, I really enjoyed this afternoon. And I think for me, the closing, the greatest thing for me is to tell people to reach out. To just reach out and don't be afraid, don't be ashamed of what you may be going through or what your needs may be, but to reach out, reach out to those that you trust and so that they could connect you with the various resources that are available, and particularly, with groups like this where you have people here that are working collectively to make sure that our seniors get the best care that they possibly can, reach out, and don't be afraid. And the other thing too is that, in reaching out, sometimes just having those conversations can kind of help you make better decisions. I had a conversation with the senior and, she didn't want to take the vaccine and she kept asking questions and she wanted to know, well, who was the manufacturer? If you're going to schedule the appointment, who's the manufacturer? And we laughed a little bit. And then what it turned out to be was like, well, did you know who was the manufacturer of the flu shot that you took last year? She had no idea. She said, how silly and crazy I am because I'm just listening to all this information. But we have to stop and think about with social social media. There's so much more information out there that translates. But, the seniors, they've been used to this, the vaccines and boosters for years. I mean, so it's not some new phenomena, that we're talking about. But because of all the misinformation, it's a little different these days. And so, and I would just say that, those are professionals and those that are helping the seniors, we just need to be patient. Be patient because they're all at different levels in terms of, comfort and how they're feeling about things, and be supportive. How can I support you in the decision that you want to make? And so, other than that, I just wish everyone, many blessings, and just let's continue to work together, and fight for, full equity for our community, as we know, is so overdue. Thank you.
All right, and Dr. Abraham, closing thoughts, I'd like you to answer a question as well. How can people convince others that it's safe to go out as well? And your closing thoughts.
Sure. I'll start by saying we're not going to go back to business as usual. Business as usual killed far too many people this last year. It left too many people out. And even when we look at vaccination rates in our community, when we look at vaccination rates of our men, they are far lower than they ought to be and far lower than women and others in the community. So we're going to have to work on understanding how we can reach people better, including how Black men access healthcare and their vaccines. And I think Dr. Gaines is exactly right. As Professor Sams mentioned as well, people have been getting, the pneumonia vaccine, the shingles vaccine. I mean, so it is kind of interesting. I get it. This is new and scary. So we will meet you where you're at, but this is that gateway. This is that opportunity. Don't be afraid to reach out for help. We do need those mental health checks. We do need to get our sugars checked. Those are all for you. Just like this vaccine's for you, that healthcare is for you, and you should take it and take it proudly. So really hope that this starts a conversation, that there are good places, safe places that you can go to get the care that you need. And then as how do we talk to people? Bring them to a place like Kedron, where we will spend the time and we will discuss with them. There's so many websites out there with good information from your Department of Public Health. There's that conversation about us, between us, with Kamal Bell, where there's some really good information from the Kaiser Family Foundation and others on how you really engage those that are hesitant, reluctant, or even those that just have barriers to getting a vaccine but would like one. So there's still a long way to go, but what we know is we've learned a lot. It is critical. If we go back to the way things are, we have gotten so far. We still have a long way to go to achieving health equity, to really making sure that we address the injustices we see every day in our healthcare system. And so we've learned from this, and now we must go further, and let's not miss that opportunity. Please take your shot. Please access mental health. Please get your annual visits. Please do everything that you need to do so we can get back to doing all those wonderful things, all those missed memories that we've lost in this last year. Let's regain them in 2021 and beyond.
All right, thank you. And I'd like to give a special thank you to our esteemed panelists, Dr. Jerry Abraham, Dr. Brian Gaines, and Professor Jarvis Sams. I appreciate you. Rosa Park Villas and Judy Johnson, thank you for participating in this event. Community ambassadors, Carolyn Odom Burlinson and Joyce Lampkin, thank you for submitting questions from the Senior Center. I won't thank myself, I'll leave that, but thank you to our seniors for being on and listening, and we will try to get this rebroadcast as well for anyone who missed it. We will leave, I also put the link to our SurveyMonkey in the chat, so we'll leave this presentation open for a couple of minutes if you want to grab that. And if you signed up through Eventbrite, we will send you through your email the survey so we can know what other topics should we cover. Should we bring this back again? What are other things are the community concerned about that we can maybe bring experts here to answer those questions. So thank you everyone for showing. I appreciate you, and enjoy your end of your weekend.
Thank you.
Thank you.
Thank you everybody for coming.